Says DPH 175 lecture series, and if you click on that, you'll see our current presentations for this quarter in today's slides that you can see for yourself separately, as well as following along on the Zoom presentation this morning, but also the slides from our previous presentations going back a couple of years in some cases, and so that's a nice resource for people. And so having mentioned that, I will now introduce our speakers for today. First of all, Dr. Vinodh Bhoopathi is a diplomat of the American Board of Dental Public Health. He graduated with a bachelor's in dental surgery from Tamil Nadu Dr. MGR University in India, holding a master's in public health degree from East Tennessee State University, advanced residency degree in dental public health, and a doctorate of science in dentistry in dental public health degree from Boston University, from BU, Henry Goldman School of Dental Medicine. He has previously worked at the Dental Bureau of New York State Department of Health. I'm assuming you can all hear me okay. And also worked at BU Dental School and at Nova Southeastern University College of Dental Medicine. He's currently appointed as a tenure-track faculty in the Department of Pediatric Dentistry and Community Oral Health Sciences at Temple University in Philadelphia. His specific research interests include access to dental care, health disparities in pediatric populations, dental workforce issues, and dental education. So he's a busy guy. Matt Jacob, who will also be presenting sort of halfway through the slides, he has a fascinating background in journalism, which he may share with us. He's the Director of Communications and Outreach for the Children's Dental Health Project, a policy institute in Washington, D.C. He advised oral health advocates in numerous states on effective strategies and messages. He chairs the Project Advisory Committee of the Campaign for Dental Health. Some of you may know that by the URL ilikemyteeth.org. An initiative launched by the American Academy of Pediatrics in 2012. So with that, Vinodh, if you would take over and you'll advance the slides yourself.
Yes, sure, thank you. I hope everyone can hear me as well. Can you?
I think we can.
Okay, perfect. Thank you, Dr. Pollock. Thanks for a wonderful introduction. Again, hello everyone. I'm Vinodh Bhoopathi. I'm an assistant professor at Temple University Kornberg School of Dentistry in Philadelphia, Pennsylvania. Honestly, you know, it feels as if like coming back to home. The reason is, as a dental public health resident and as a doctoral student 7 to 8 years back, I listened and learned a lot through this online platform for so many years. You know, UCSF DPH seminar series was a part of our learning program, our curriculum, and so I learned a lot through this seminar series. And so it's a very great feeling to be actually doing a presentation on the other side. And so I thank Dr. Pollock for inviting me and of course, Matt Jacob to do this presentation. So without any further delay, you know, let me start the presentation. So the outline of today's presentation, we are going to focus a little bit on the events and observations that you know, led to this project. You know, how and why, a little bit of background, and you know, why did I think about advocacy and an advocacy toolkit. Next, we'll talk about the purpose of an oral health advocacy toolkit. Following that, we will discuss a little bit elaboratively on developing the toolkit in terms of philosophy, what was the process, the structure, and of course, any document like this, when you create, you do need to improve the content and face validity. And so we had a couple of rounds of reviews done by experts, including Dr. Pollock. So we will discuss about the insights that we received from our reviewers. I will briefly talk about pilot testing this toolkit for a honors program that I had developed, and finally we will discuss whatever ideas towards disseminating this toolkit effectively. Just a little bit background of as to how and why I arrived at this idea of developing an advocacy toolkit. I should say that it dates back to 2011, 2012. That's when I had actually graduated from a doctoral degree program and was being recruited to Nova Southeastern University. Exactly at that time, the American Association of Public Health Dentistry had received a grant from HRSA, which was co-led by two of my greatest mentors, Dr. Anna Karina Maskinis, who's now at Nova Southeastern University, and Dr. Catherine Atchison, who's now at UCLA. The project was titled, as you can see, Developing Competencies and Curriculum in Dental Public Health for Dental and Dental Hygiene Students. And it ran for almost 5 years, from 2011 and 2015, and I had a great opportunity to be the lead program manager and also the subcontract PI for this grant, and it taught me a lot. And this was the major turning point, at least for me, to understand more of how dental public health and population health principles can be integrated into dental and dental hygiene curriculum. And this was another turning stone, major project that actually highlighted the importance of having competencies in dental public health for dental and dental hygiene students, because as you know, we do have postdoctoral dental public health competencies, but at the predoctoral level, what is the competency level of a graduating dental student or a dental hygiene student in terms of dental public health? So this was a cornerstone project in my mind. So yeah, I was really glad I was a part of this project. I'm going to very briefly talk about this project that will give you an idea as to why advocacy. Two of the major 4 objectives of this project that ran from 2011 to 2015 was to develop a set of core dental public health competencies for predoctoral dental and dental hygiene programs, and also to develop a model curriculum based on major themes that we developed from the competencies, so that it could be available for use by different dental and dental hygiene faculty across the globe. So those were the 2 of the major objectives, 2 of the 4 objectives that are relevant to the topic that I'm going to talk today. So an expert panel of varied dental and dental hygiene faculty and administrator developed 8 dental public health competencies for predoctoral dental and dental hygiene students through the project. And one of the 8 competencies stressed that advocacy should be a competency for predoctoral dental hygiene students, and it clearly says that a graduating dental or dental hygiene student should be able to communicate, not only communicate but also to collaborate with all relevant stakeholders to advocate for oral and general health in general. So based on the developed 8 competencies, we developed different curricular themes and started developing course materials and student activities based on these 6 major curricular themes. And as you can see, one of the curricular themes and courses that we had developed at that point was policy and oral health advocacy. If some of you on the call do not know about these courses, I would like to suggest you look at the APHD webpage using this link, and there are almost like 6 different courses, principles in dental public health course. That was what I developed, and there were some experts from Connecticut and UCLA who developed dental public health policy and advocacy. So all these materials are freely available through APHD. So if you need to access these, it's readily available. So as this project ended in 2015, I think exactly when I had moved to Temple University, and I've utilized many of these course materials developed from this project, including materials from dental public health policy and advocacy, for my public health courses that I do teach at Temple University. The course that we had developed for this APHD HRSA project on policy and advocacy was a 2-hour course. It was mainly a basic level course that talks about types of government, what is policy and law, what advocacy means from policy and legislation perspective, lobbying, and that was the main focus of that course as well, to have an introductory understanding of what public health policy and advocacy. As days went and I started understanding more about advocacy, I came across this definition which embraces a much broader concept of what advocacy is all about, and it also enhanced my understanding of what advocacy can also be more than legislation or policy. And advocacy can be to be an advocate. You can speak up, lead, or to champion for a cause while applying professional expertise and leadership to support efforts on individual, it can be patient or family level, community, and legislative or policy levels, which results in improved quality of life for individuals, families, or communities. Most of the times when we talk about advocacy, we talk about the legislative policy levels. We don't talk at the individual, community, or the patient level. So this got me thinking, and I wanted to work more to contribute to the field of advocacy, and also understand through that journey as to how we could make or train graduating dental or dental hygiene students as better public health advocates. I'm not sure if how many know the CODA, which is Council on Dental Accreditation, which is accrediting agency for dental and dental hygiene programs, includes advocacy as a part of didactic and clinical training for graduating pediatric dental residents. I think this mandate was brought in place and probably in 2013. And so the pediatric dental residency programs at this point should train all graduating pediatric dental residents, both didactically and clinically, in advocacy. However, again, it's very unclear, however, whether all graduating pre-doctoral dental and dental hygiene students, do they know what advocacy is? Because I do think, dental professionals have an inherent social responsibility of being an advocate, but are they being trained, or do they know what advocacy is all about? A 2013 study, it was a kind of a literature review, and published by Melby and Armfield, it cited that the importance of dentists promoting water fluoridation in their communities, but it also stated that current undergraduate dental curricula do not adequately prepare dentists, just focusing on promoting water fluoridation for this advocacy role. So the study mainly focused on water fluoridation and how, and addressed how graduating undergrads, graduating dental students or dental hygiene students are not prepared for advocacy role at all. If you look at the medical field or medical education, I think advocacies, it's not a mandate at the undergrad level, but again, for pediatric residents, advocacy is a required didactic and clinical standard. But even though it is not a mandatory competency for at the undergrad level, there are many medical schools that have already integrated some kind of clinical or didactic training in advocacy in medical school curriculum. So, is there evidence or impact of advocacy training in dental curriculum? Actually, there isn't that many studies that actually do talk about what happens after training them in advocacy at all. So this led to one of our studies that we conducted in the study was collected in data was collected in 2016 and was just published in JDE. We targeted the APD members, the American Academy of Pediatric Dentistry members, and kind of we did many different things. However, one of the objectives was to find out the association between pediatric dentists' previous training experience in a dental education training program and the current willingness to advocate for water fluoridation. So this was very specific. We asked them, are you willing to advocate for water fluoridation at different levels? So this was not very generic question about advocacy, but it was very, very focused. And we found out that those who are willing to advocate for water fluoridation were more likely to have received training in advocacy during dental education. And this association was very, very strong compared to those who were not willing. So this gave me a kind of a sense of relief, at the point that, maybe training dental students on advocacy is definitely, it is feasible, and that it in fact may help their advocacy skills. Though in this study, we only assess their willingness to advocate for water fluoridation, which we do still think, it's a very first step and positive finding that we could not dismiss. So, this kind of gave me a motivation, or a pat that said, okay, if you in fact do train dentists on advocacy, probably, they may be willing and in fact may go over and beyond and do advocacy, maybe. So, we did this study, and I was still researching on and understanding more about advocacy, and that is when the Department of Health and Human Services had put out a funding opportunity announcement under the predoctoral pediatric training in general dentistry and dental hygiene program in November 2016. And one of the, though the primary goal of the program purpose was to enhance predoctoral dental and dental hygiene students, acumen or skills and competencies in treating children 0 to 5. the application strongly indicated that the proposal should be able to incorporate population health and social determinants of health principles into the training. And so that is where my dental public health specialist hat came in. And I said, okay, I am going to write this proposal and focus a lot on population health principles that I think is important to be included in dental school curriculum or a dental hygiene curriculum. Unfortunately, when I was writing the grant, I couldn't find any good collaborators for a dental hygiene school. So I just focused on writing a good proposal that would enhance our dental students at Temple University as skills in population health principles and social determinants of health. So fortunately, I was funded by HRSA in July 2017 for 5 years. This will run until 2022, which I have titled Pediatric Patient Care, Population Health, and Community-Based Training Project for Dental Students. I'm going to stop here and open for questions. Is it the right time for asking questions, or should I still go ahead and complete?
Sure, sure. Let's open it up. If you have a question at this time, just unmute your phone, and we'll see. We'll just give people a chance to ask a question. If there aren't any within a few 30 seconds or so, then we'll just continue.
Sure, I'm still talking about the background piece, so.
I understand.
Can you hear me?
Yes.
Yes.
Could you expand a little bit on the you mentioned earlier that how this relates to nutrition and obesity? Could you expand on that a little bit? Because we're attempting to work together with OHI here. And could you expand a little bit more about the pediatric dentistry and how it segues and works together with nutrition and obesity?
Sure. Well, that is a so in my HRSA grant proposal, I had 10 different objectives. The one that I'm going to focus on today is on oral health advocacy, but also unrelated to this presentation, probably is something that we are working on a nutritional counseling and obesity prevention protocol that can be adapted by dental and dental hygiene programs, but that is not related to the advocacy toolkit that I'm going to discuss today. We can connect later on and talk about that.
Thank you.
Okay.
Okay, if there's no other questions, just please continue. Thanks.
Okay. So one of my proposed goals, I had two different goals. One is to improve the clinical skills, of course, of dental students in treating children 0 to 5. But my second and most elaborate goal, again, because I'm a dental public health specialist, to prepare the next generation of Temple School of Dentistry graduates who will be able to address social determinants of health and population health principles in improving the oral health of vulnerable and underserved groups, especially if you look at the area that we are located at Temple University. It's one of the most underserved and disadvantaged neighborhoods, and that is also one of the impetus for me to write this proposal. So out of 10 different objectives that I had proposed for my HRSA grant, one of the objectives was to, again, based on my background with advocacy and my interest and motivation to do something more on advocacy, I thought, okay, developing an oral health advocacy toolkit and maybe coursework to provide dental students with additional public health advocacy skills would be a good idea. And apparently HRSA thought it was a good idea. And so, yes, that was one of the objectives, and we started creating this toolkit with the main idea that this toolkit should be made available for dental hygiene, and dental residency programs that wish to initiate advocacy training or refining their existing courses to create awareness of advocacy and provide tools and templates to support advocacy. Because I think advocacy is once it's a difficult topic, but it's kind of different from the norm that not everyone may be able to get materials off the web. So developing this toolkit and giving it to already existing faculty with some kind of expertise may be useful, and that was the purpose of the toolkit. Of course, it will be useful in dental and dental hygiene programs and residency programs to train the students, but we have an existing captive audience, or like existing practicing dental professionals, both dentists and dental hygienists, who I think when trained and if they do understand the exact role of what advocacy is all about, they can make contribution to the community that they practice. And so I think the associations and societies that represent dentists and dental hygienists can also use this toolkit to develop workshops, seminars, maybe to train or interested dental professionals who can do advocacy or who are interested in doing advocacy. So when I was writing this proposal, I couldn't think of anyone else but the Children's Dental Health Project, because they are experts in advocacy. They do so many great things. I have great regard for this institution, organization. And again, I've met Matt before. I've talked to him so many times before, and I couldn't think of anyone else but to collaborate with Children's Dental Health Project and Matt. So I shot out an email to Matt and both CDHP, and he was on board. So that is where our collaboration started in developing this toolkit. So the philosophy is, if you think of advocacy, advocacy can be broadly categorized into self-advocacy, which is you usually speaking for yourself. But I think a public health advocate would do a lot more of individual and systematic advocacy rather than a self-advocacy. And the philosophy of developing this toolkit was mainly focused on someone in developing the skills of someone who could do both individual and systematic advocacy. Individual advocacy is to speaking up on behalf of someone else, and systematic advocacy is to speak for those who cannot speak for themselves. So these are quite different from self-advocacy, and I think all dental professionals and healthcare professionals in general, they do have some kind of social responsibility to do individual or systematic advocacy in some or the other way. And the philosophy is that the individual systematic advocacy can be performed through different strategies and actions that are equally important to advocating for a legislation or a policy, etc. And hopefully, some of these strategies and actions that are listed here, or some of the examples of advocacy strategies, are also feasible and achievable with practicing dental professionals. For example, many may not resonate whatever that is listed here as advocacy, but it in fact is some form of individual or systematic advocacy. For example, writing a letter to the editor of newspaper covering oral health issues can be considered a form of individual or systematic advocacy. Even tweeting, there are many advocates out there whose tweets as form of advocacy is considered with high regard. Even submitting online comments about a proposed change in federal dietary guidelines. All these are some of the strategies and actions, that they're a part of individual and systematic advocacy. Now I will turn the table to Mr. Matt Jacob.
Before Matt comes on, I'm just wondering if there are any questions.
Sure.
Please unmute your phone if you have a question. So I have a question. I'm glad you showed those examples on the previous slide, because that could be used in the education programs in dental hygiene, and also dental public health residencies, pediatric dentistry residencies, and others, as providing evidence of a resident or a student having actually done some advocacy. So I think those were very useful, I think.
Sure. And again, as I mentioned before, many when they think of advocacy, it's all about legislation, policy, meeting the lawmakers. Yes, it is part of advocacy. Those are things, but there are other ways to do advocacy as well, and these are some of the examples that we think are strategies and actions to do individual and systematic advocacy. Those are just some of the examples.
And then just as a follow-up, could you discuss a little bit about the difference between, as a healthcare provider, providing care to an individual, child, or adult, and educating them? How does that differ from advocacy?
It's a very fine line, I would say. For example, an individual or patient level advocacy, for example, asking parents to drink fluoridated water, though I think it is kind of oral health education, but still can be considered an advocacy, because we are talking about a population level intervention that many people do not know, and having the benefits of water fluoridation to parents and children, and highlighting that not only is education but also is advocacy. Did I answer your question?
Yes, I think it does. I think it just is one step beyond individual patient education. It's reaching out beyond your immediate environment to advocate for something on a wider scale. So I think that's like you say, it's a fine point.
Yes.
Okay.
Can I ask a question after that?
Please.
Yes, my question is based on the previous discussion, and my question was about engagement of the people. I know that we have the information. For example, this presentation is excellent, but we are providing the information to a specific group of people. How can we spread and disseminate the information to the larger group in communities to engage them towards the advocacy?
Okay, so those are the things that Mr. Matt Jacob will explain. Different components of advocacy, how you can engage different stakeholders and all that, and he will talk a little bit elaboratively on 13 different components that we thought are or very important aspects of advocacy. So
Okay,
yeah, he will talk about them.
Okay,
thanks.
thank you. So Matt.
Thanks.
Yes, thank you, everybody. Can you hear me okay?
Yes, we can. Thank you.
Okay, great.
Matt, let me know when you want the slides to move forward. If you say next slide, I'll maneuver the slides.
Absolutely. Yes. Next slide, please. So I'm going to talk about developing the toolkit, the process that we used in collaboration with Temple University's Kornberg School of Dentistry. One of the first things we did is we kind of wanted an anchor. We wanted an objective standard to help shape our development. And so we relied on the Agency for Healthcare Research and Quality, AHRQ, their guidelines, which they had developed for publishing a toolkit. And I've just provided a sample of, this isn't every single element of those guidelines, but these are some of the key components of those guidelines that are really aimed at making sure that a toolkit is, first of all, important, and that we don't sort of label anything a toolkit. Also, just kind of some operational approaches to developing that toolkit. You know, the testing of the toolkit. We both Temple and CDHP took that aspect very seriously, as obviously AHRQ does. We felt that that was very much reassuring. So these are just 6 quick examples on a high level of the kinds of things in place by AHRQ that were really kind of an anchor, a starting point for us as we began our planning. Next slide, please. So beyond that, we at CDHP, we conducted an online scan of toolkits. We looked for toolkits that focused on oral health or other health disciplines, and we did that just to understand what is kind of the current state of toolkits. You know, what are toolkits talking about? And here are some examples of the toolkits we found. Families USA. Next, yeah, this one was from the National Conference of State Legislators. This one is from NACHO, the Caries Prevention Partnership, FDI, and finally, I think there was one more, yeah, the National Council of La Raza. So, excuse me, these were simply 5 of over 40 different toolkits that were, in our mind, fairly comprehensive, were designed by organizations with robust design and you know, a pretty core competency. But we looked at some of the standard elements of those toolkits, and I think one of the things, next slide please, that we found that while a lot of these toolkits were really helpful, they seemed to contain very relevant and helpful information. We did find that there were certain elements that did not tend to be a part of those toolkits. One of those elements was how to identify new partners. And when I use the word partners, I'm using that synonymous somewhat with the term allies. You know, I think we all have a comfort level of who we look to be potential allies, but we think it's very important to provide guidance and some recommendations for how to identify organizations that might be non-traditional partners, might not be groups or individuals that we would necessarily look to by instinct. The second one was media strategies. Excuse me. And somewhat related to that, we really talk a lot more in this toolkit than the typical toolkit does about appropriate vehicles for disseminating those messages. And in that respect, I was pleased to hear the question from one of the attendees about, you know, well, so how do we go about that, right? How do we reach a target audience? And that's an important component of what we talk about in the toolkit is, you know, picking a communication vehicle with that in mind, understanding that that social media platforms are not just different names, they reach different audiences. The demographics that you reach from Instagram compared to Facebook, compared to Twitter, and so on, are going to be different. So, where you might choose to have a presence would be somewhat shaped by the target audience you're trying to reach. If you're really trying to reach parents, specifically, Facebook might be an ideal platform. But if you're trying to reach millennials, then you might want to look more at Instagram and so on. So that's kind of linked up to media strategies overall. But then the third component was planning. You know, an awful lot is focused on execution, but we felt as though there could be more about planning. What kind of elements do you need to have in place before you actually start advocating, in terms of even deciding on your priorities, you know, as opposed to just kind of in a haphazard way saying, oh, well, you know, this came up, we'll advocate about that, or we'll post something on our social media about that. But really having some priorities determined so that you are less likely as an organization or stakeholder to kind of randomly jump in this direction or that direction. And then finally, I think we felt that most of the existing toolkits were either mostly or totally lacking in any kind of worksheets or templates that could help walk advocates through how to actually use these components that we have. Next slide, please. So let me talk about some of the insights that we received from external reviewers. If you'll recall, ARC mentions one of the guidelines for Toolkit is to pilot test that. And we took this stage very seriously, both Temple and CDHP. So we had 3 different phases of external review. The first was we reached out to staff or senior staff and officers of advocacy organizations that were very much active in this space. We got some top-level reactions from them and feedback that really helped to shape where we took the toolkit from there. And I think, you know, one of these are just 4 examples of some of the suggestions we heard from them. I wanted to call attention to these just very briefly. So the first one, you know, data can be very powerful, but I think that there is some value in stressing the fact that we don't just want to sort of throw data at the public. We know lay audiences may struggle to sort of understand how that data fits or its relevance. It may be thrown out in a way that doesn't connect it with pre-existing knowledge, et cetera. So sort of avoiding the data dump, but how to share the right data and in the right way. There was sort of the understanding, for example, that the policy environment can change quite unexpectedly, and that, you know, advocates have to observe and adapt to these changes, you know, when those occur. You know, I think sometimes there's this sort of assumption written into toolkits that, well, you know, you're planning this campaign and you just kind of go along these 8 or 9 steps without understanding that the context can change. And, you know, I think that last but not least, and we heard this from someone who was an officer with the American Student Dental Association, was, you know, really making it as easy as possible to participate in advocacy. And some people will be on a committee and will show up at a rally or go, you know, when the State Dental Association is doing, you know, an event at the state capitol, you know, lobby day, you know, they'll show up. But most people won't, for whatever reason. And so, you know, not sort of counting those people out, but, you know, making sure there are clickable ways for them to, you know, sign their name to a petition or, you know, send an email to a state elected official, et cetera. Next slide, please. So phase 2, these were attendees of the National Oral Health Conference. During 2 roundtable sessions, we solicited input from them. You know, there was an emphasis on having tools and templates that would make this toolkit more usable, you know, so that it wasn't really seen as more of a didactic kind of form of education, but that, you know, students in dental and dental hygiene could actually, you know, test their ability to use and apply these skills. We also received reassurance that I think was encouraging, that, and Vinodh talked about this earlier, you know, that the definition of advocacy should not be sort of straitjacketed into this kind of, you know, well, it's all about laws or regulations, that advocacy can take broader forms, that it is also about attitudes and knowledge. We know, collectively as health educators, as health providers, that, knowledge and attitude shape significantly oral health and overall health. So, just really building that in. And there were some tips we received also on how to market the toolkit that we expect to be ready early next year. We also circulated a sign-up sheet to collect names of additional individuals who were willing to participate in a third and final stage of review. Next slide, please. These were individuals from the academic community, and we received a lot of useful information there. I think the very first bullet point I want to kind of emphasize is what was, I think, very helpful, and that is to say that there are more concerted long-term ways to engage in advocacy. Let's say, for example, you live in a state where the adult Medicaid dental benefit is an emergency-only benefit. So basically, unless you have a dental emergency of some kind or you need a tooth extracted, the Medicaid program doesn't really do much to cover you. It's not at all like Medicaid is for children. Let's just say you wanted to change that. You got together with a coalition or others. That is not something that sending a single tweet or writing one letter to the editor is going to change. Even though those are advocacy actions, that kind of advocacy goal is going to require a more kind of long-term concerted campaign of multiple phases. However, at the same time, we do want to make it clear that there are simple, episodic, self-contained ways that one can advocate. Tweeting or retweeting something, some information or a fact sheet that you saw, or an interesting provocative article that was published, from your Twitter account, or going to a health fair and talking with parents and other members of the community and answering their questions about sugar sweetened beverages and water and so on. These are very, very good examples of just simple ways people can engage in advocacy. And both the episodic and the more long-term campaign-oriented forms of advocacy are both important and both needed. I want to emphasize too, there was a question about obesity, nutrition earlier. While Vinodh was correct in saying that, the toolkit does not focus on that area, we did make an effort to include, I believe there are multiple examples, as scenarios of how to advocate in a sort of situation where, for example, maybe there's a campaign in the schools to limit access by students to sugar-sweetened beverages. So we certainly tried to provide some examples or scenarios that did remind people, not only in dental public health, but who are currently being educated at dental schools or dental hygiene schools, that we want them to think of the potential for advocacy as very broad and being able to really improve the community landscape as far as health is concerned in that way. Next slide, please. Okay, so the structure of the toolkit, I'll walk through this quickly. Next slide, please. So, we really felt before jumping into, hey, here's one tactic, here's another tactic, we really felt it was important to have this larger definition of advocacy, what form it can take, as well as how to build a culture of advocacy within an organization. Next slide, please. And these are the 13 components of effective advocacy. Again, as Vinodh mentioned earlier, you don't have to use all 13 of these on any day or any week or in any campaign to satisfy the definition of advocacy. But our feeling is, for longer term campaigns, there's a good chance that many or most of these components are going to be very helpful in reaching success, in achieving success with your objective. Next slide, please. Tools and worksheets, again, as I mentioned, we felt these were very important, obviously for the students, but also we understand that faculty at these institutions find it very helpful. They may look at content and say, oh, this is all quite interesting, but sort of how can is there an exercise or a way for me to really kind of let my students work through a simulation or kind of a role play exercise or something to kind of assess their understanding of this concept. And so we really wanted to put those in place. And we have more of them than I think I've seen in any other toolkit, oral health or health related. The next slide, please. And then, there are some appendices where we offer additional resources. We provide some scenarios, again, for faculty to assign to students or talk through with students. But the additional resources, we didn't want to pretend that we are the only place to go for information. There are obviously a lot of state and national organizations that do very admirable work to improve health systems and health outcomes, and we wanted to, pass along those as a possible resource. Next slide, please. Yeah, so I will turn it back over to Vinodh, who's going to talk you through ways in which we pilot tested this.
This is Howard. Thanks, Matt. I'm going to pause and see if there are any questions from our listening audience. Just unmute yourself to ask the question. Well, while people are thinking of a question, Matt, I have one myself. A few slides back, the bottom bullet point was mentioned lobbying. And in my introductory remarks, I was hoping that we could have a bit of a discussion about the line in the sand between advocacy and lobbying. Could you speak to that a little bit?
Yeah, I can. If I were a lawyer, I'd probably charge you by the hour. But I mention lawyers simply because lawyers end up adjudicating these kinds of things, and so I will say this though: what I have learned is that the definition of lobbying and where that line is between lobbying and simply advocacy can vary from state to state. And so I mention that to this extent. There are some states that can require organizations or individuals who are sending educational materials urging a yay or nay vote on a particular law or bill or regulation to register with a state disclosure office that simply says, hey, this is who I am, this is who I work for, who I'm employed by. I am going to be sending, some educational materials that are urging, legislators to vote this way or that way. And so, this can vary though, like I said, states that are right next door to each other may have very different laws on that. So if you're dealing with a state legislative issue, I certainly invite people to explore what rules of disclosure may be required. I don't know that it's necessarily, registering as a lobbyist, quote unquote, but there are disclosure laws in some states that do require you to register. And in theory, if you don't, register your name and information, they could choose to fine you. But it's kind of more of a case of better safe than sorry. I don't think states are terribly punitive on this score, but it is worth checking into.
Well, I was just thinking in terms of if I wanted to visit a state legislator's office, maybe talk to the staff about a certain bill that's going through, and I'm just wondering if there's a clear distinction between those who are paid to do so, with the kind of high price lobbying remuneration that goes on, or just an individual citizen or a student or somebody who just wants to go and talk to their legislator to encourage them to pass the bill. And I'm just wondering if that is a clear criterion, is are you paid to do this by somebody or not?
Yeah, generally speaking, Howard, I think that is the case. It is if you are a resident of that state and you're communicating to your state representative or assemblyman, or you're communicating to a state senator or governor, writing a letter or email, that is considered advocacy. I think if you're sending information to the entire legislature, that's where I think it can get fuzzy. I don't know enough to definitively say that would just be considered advocacy. So I do think that I don't want to scare people, but I do want to encourage people to look into that within the state in which you reside. If you're doing more of a large scale, multi-legislator kind of thing, if you're simply volunteering, does that differ from if you are paid to do it? I think it does, but I'm not certain. So I think the California Dental Association could be, for example, within the state of California, a good source to check with to get some clarification on what, if anything, you might need to be mindful of as you engage in more large-scale advocacy efforts.
That's good advice. Thank you, Matt. Are there any questions from anybody? If not, then I guess, Vinodh, you're taking over now?
Okay.
Okay, thanks.
So, we created this toolkit. We had all the comments from the reviewers integrated into it. And then ultimately, the components of the toolkit, we would want to, utilize it to train our dental students here. Again, this toolkit, it's almost done. We will disseminate it very soon, and we will talk about it in a little bit. It's almost 70 pages. It's all at the, I would say, final stages of developing it. We at Temple, because it's a huge toolkit, using the toolkit in entirety to train our dental students was not possible. And as you know, the dental school curriculum is so tight. Finding enough hours to train dental students and population health or public health related principles is very, very difficult. So to begin with, I teach a course which is called as Health Promotions and Populations for dental students for sophomores. And Matt had developed an introductory, or I would say, that which highlighted the major components of advocacy and how students and dental professionals can do it in the field, which was a 45-minute lecture. And then this was another objective for my HRSA grant, was to develop a community dental student leadership honors program, where this is not part of the dental school curriculum, but it's only for interested dental students who would like to learn more about leadership, community engagement, and advocacy. It was open to sophomore year students, and we received close to 30-35 applications, but unfortunately, due to funding demands, I had to recruit only 15 students out of 35 applications. And there were 3 components to this honors program. It's for selected 15 students whom we have to spend additional 50 to 60 hours away from their actual time being in the dental school on some weekends or during lunchtime or after school hours to be a part of this honors program. One of the focus of this program is for students to understand the different ways they can be effective advocates of health for all those in the community that they serve. So as I said, the community here is the main focus, and we try to improve our students' skills in leadership, advocacy, and community engagement. hoping that this will enhance their competencies to become effective community leaders. For this program, we had a list of experts talking to our students, just these 15 students, on leadership, community engagement, and Matt had come back to dental school again and did a 2-hour lecture, maybe a little bit more detail on the different 13 different components that he had mentioned. And this was also a great way or opportunity for us to test some of the activities that we created for dental or dental hygiene faculty to use if they take this toolkit and administer or train their students. For example, this is one of the scenarios that we came up with, choosing the best allies. Students, they are advised to develop their own advocacy goal. It can be hypothetical. They have to create a list of stakeholders or individuals who would make the best allies for achieving their advocacy. They either have to do identify the type of people or groups that they might be natural allies. They will conduct an online scan. So this just gives you a scenario, some of the student activities that we had developed and actually tested it. And students did pretty well, especially using the toolkit. The toolkit has very elaborate explanation of all different 13 components. So we pilot tested it, especially the student activities, and it went really well. So our next step is, again, as I said, the toolkit is almost 70 pages. It's the last pages. It's on my desk. I'm making the final corrections. CDHB has been a great help. They did an amazing job. And it's in the final stages, and we will probably get it done, hoping that by December or at the max January, and then we'll get it designed. We have a wonderful designer that we have hired, and it will be hosted online at Temple University webpage, dental school webpage, and also disseminated through various different conferences, hopefully at ADIA, ASDA, National Oral Health Conference. Should also be able to do it with dental trade media. We'll use social media to promote it. Of course, I'll send it through the Dental Public Health listserv as well. I have really good contacts for both dental schools and dental hygiene program directors. I have requested them to send it through their listservs. So there are various ways that we are planning to disseminate. If others have any ideas of potential dissemination, we welcome your thoughts.
Well, certainly, although the timing is appropriate for the National Oral Health Conference in April, you're going to have this ready by then, I assume. And
yes.
But, also the oral health section of APHA, American Public Health Association, although that's later in the year.
Yes.
Mm-hmm.
Yes. Yes. I have submitted an abstract for the National Oral Health Conference, so hopefully it gets picked. We will, if it gets picked, we will have this toolkit printed. We will have some copies, close to 35 to at least 50 copies to distribute. But mainly, we will have it as an online link so that anyone can download it as well. Yeah. I would like to acknowledge the HRSA of the U.S. Department of Health and Human Services for providing me with this $1.6 million grant. It's been an amazing experience getting to work on this grant. Thanks to her, sir. And thanks to all our external reviewers, all reviewers, I really, really appreciate their thoughtful responses. We had a really good mix of, experts from the field who actually do advocacy on a daily basis, student representatives, and also from academia. So it was a handful of right mix that we had, and we appreciate our external reviewers' input on this toolkit. And last but not the least, I would like to thank Mr. Matt Jacob for being extremely patient and willing to actually work with me. Especially, I still do remember when I emailed him the very first time when I thought about it. I didn't know what he would think about my idea, and he immediately replied saying this was an excellent idea, and it's a project. It makes it even better when you have very when you work with professionals that have thoughts aligned and have very similar intentions. So it's been great working with CDHP and Matt. Yep, thank you.
Well, that's great. If you would leave it on the last slide, then we can continue the recording of our conversation. Really appreciate both of you to spend the time to, well, obviously to share it today, but also all the work that's gone into this. And I think it's going to be a very valuable tool, the toolkit, for the future, and very valuable because it has broad application. It's not just specifically for one aspect of oral health, but I'm sure that the content will show that. You didn't really focus in this presentation on content.
Yes.
But
so the reason why we didn't do it is because the 13 different components by itself is we have different chapters. So within the time constraint and all that, we didn't want to go too much in depth to individual components. But maybe in the future we can, when the toolkit is all done and disseminated, and if people would still like to listen.
Yeah, that'd be great. I'm so pleased that I was aware of what you were doing, or meetings at the National Health Conference and other venues, that I thought this would be a great presentation for our audience, and so thank you for that. In terms of content, I was also thinking in terms of, although it was mentioned in passing, the ideas of trying to promote, Medicaid dental for adults, expand water fluoridation, that came up, focusing on early childhood issues. And I'm just wondering, in the 70 pages, do you go into those content areas to any extent?
We don't go into those content areas in great depth, but I will tell you that we made it a very, we were very careful and very, deliberate in citing those issue areas as topics for some of the scenarios that we developed for the role play, dynamic for faculty to use. We really saw those kinds of issues as critically important, and so it was not by accident that they show up as examples throughout the toolkit and as scenarios. So I just, Vinodh, feel free to chime in if you wish, but that I feel strongly that the examples we gave really give this toolkit I would say, a strong public, dental public health orientation.
Yeah, and I didn't want to exclude any of the other issues that are favorites of others, such as sugar-sweetened beverages, which was also mentioned. So I want to open it up for general discussion. I really encourage people to ask questions or provide comments. So who's going to do that? Just unmute your phone and please provide a question or a comment. Think about how this might be useful to you as an individual or your program. Whether you think that there are other materials out there that that we should also consider in terms of advocacy and toolkits. So I'm going to pause for people to fill in with their question.
Howard, I would just want to say that while we did not go into depth in the components of effective advocacy, if people do have questions about those, we'd be happy to take those and respond as we can.
That's noted. I just wonder how many people on the line have actually advocated for anything and how they did that. I can see there's a question on the chat line. People are interested in seeing the final toolkit and how is that going to, will the people who are attending this particular seminar right now be able to receive it through our distribution email list? So that's a question that was raised. And I'm sure that when it becomes available, then we can just make that distribution. So I'm going to ask you, Vinodh and Matt.
Sure.
Take examples of how you yourselves have advocated for something. It may not be in the oral health arena. It might have been something else. Some examples of what you've done.
I've been part of a lot of city council debates, or when I was in Florida. Not that much at Pennsylvania, but when I was in Florida, there were many communities that were taking on water fluoridation. So I've been part of those debates, advocating for water fluoridation. We have in Pennsylvania, we have gone to talk to State Department regarding, of course, Medicaid dental benefits. We work with Pennsylvania Coalition of, I work with Pennsylvania Coalition of Oral Health, and work with them in many capacities, not only as a member, but on different committees, advocating for, various, oral health issues that we see in Pennsylvania. Yeah, those are some of the ways that, I have done advocacy. Of course, I'm what do you call, very politically very aware, and I use social media to voice my opinions. Yeah.
Well, there's people are going to be voting or have voted by absentee ballots, or going to vote for next Tuesday across the country, and I'm just wondering whether people have gotten into supporting particular issues or particular candidates, how they've done that. I'm just wondering if there's anybody on the line willing to share their experiences.
I have not a question, but I have a kind of suggestion from my own experiences. One was that recently in a message I said there was a study about the prenatal exposure may cause ADHD problem. Prenatal exposure of fluoridation may cause the ADHD problems. So everybody has done a lot of advocacy and campaigns to fluoridate that water in that area, but just one lobby group, which is small but strong lobby group, can cause the negative effect of that positive advocacy. So if you would like to include anything relating that in your toolkit, that would be great, to how we can avoid the effect of that lobbying, which we have achieved after a long campaign and advocacy. We have got the fluoridation of water, and just a strong and small group or the lobby group can actually reverse that. So anything regarding that?
Yes, I think that's an excellent point. And there are at least a couple of places in the toolkit where we mention that, this isn't just about, you getting your message across, but when you have an opposition, which occurs from time to time, being mindful of how they are talking about the issue and to the extent to which they are taking the science out of context or ignoring the science or, distorting it in certain ways, that you call that to the attention of policymakers. You not in a angry name calling kind of way, but you just very directly, let me kind of show you what they are saying and how it is not in sync with the actual study or data that they claim to be citing. That it's important to call attention to that. I think that on the one hand, people say, we want to be very positive and we don't want to talk about the other side. That's negative campaigning or that's negative behavior. We think that there is an in-between, right? There's a way to counter what the other side is saying without being angry, without finger pointing, name calling, any of that kind of stuff, which I think we would agree is not really becoming of people in the health professions, but nonetheless that we don't take the other extreme and just say, well, we're going to ignore it, because we know that, junk science and misrepresentations sadly can take hold, whether the issue is climate change or vaccinations or fluoride, there is a lot of inaccurate information floating around. So I applaud you for raising that. And I do want you to know that we do touch on that briefly.
Okay, thank you. I just wanted to say that there must be a kind of balance we can create somehow, and there must be a solid logic and the reason, not just to point fingers on someone, but just have a solid and the professional and evident background that why we are saying what. So on that basis, maybe we need to reverse that, and that's even beneficial in the future, according to the future research. But at the moment, whatever information we have, we can only, give the solid and evidence-based scientific information that this is what we are doing, not just to let down the other group, just to make our point. Thank you, though. Thank you so much.
Yeah, I think that point
Thank
is
you.
taken, and thank you for the response, Matt.
Hey, Howard, this is Dave Weller with CDPH.
Yes, please, Dave.
Hi there. I'm the health program specialist here, and I work with the fluoridation program. American Dental Association has their fluoridation facts books, and we are going to be getting a supply of those in shortly. They've been on order, and we're just waiting for them to process. If you email me, I'll be happy to send you one of the updated pamphlets, or you can order them online. But if I send them to you, I will give them to you as far as my supply. And those have the research, the data, and the information that will help presentations.
Thanks, Dave. I think that's particularly useful for those on the line who are with the local health jurisdictions in California. The people on the call are not exclusively with in California, and many are in our various dental public health residency programs, and others interested in dental public health. So I think you're focusing your message there to the local health jurisdictions in California.
Correct, and the research based on the fluoridation information.
Right, right.
So it's an offer. If you.
Thank you. I just wanted to add, we've got a few more minutes, and I'm particularly interested in the topic, so I'm going to continue the discussion if people leave. I understand that, but don't forget, by the way, to respond if you're interested in continuing education credits. That there's a link on the email that you got from Dorian, and I want to thank Dorian for setting this up.
Thank you for bringing that up.
Yes.
Sorry to interrupt, but it's a new Qualtrics survey.
Okay.
So all of the folks that have been joining us for years who've had trouble submitting should find this workable.
Okay, so I don't know if you were able to hear that. There's a new method of getting your CE credits. There's a new link, and hopefully it will work better for you. I just wanted to also add that being a spokesperson in fluoridation for the American Dental Association for a number of years now, ADA has a couple of dozen spokespeople on different topics with the American Dental Association, and we go through spokesperson training in terms of advocacy, how we deal with the public, how we deal with journalists, how we deal with in both various media, whether it's live, camera, audio, phone, email, whatever it might be. And this takes advocacy to another level, because I noticed your leadership program, your optional honors program included leadership. And so I'm just wondering whether you get into spokesperson training on that.
No, we don't do that. In terms of our leadership program, we talk about Enneagram. Dr. Catherine Hayes, she comes in and she does a workshop over the weekend. She basically touches on, because there's a honors program, we have very limited time, and especially bringing in students at over the weekends or during off time, it's very challenging. So mainly the leadership skill, the leadership program talks about understanding their personality types, in different situations, how they can handle, but mainly around that, but not on spokesmanship, if that is the right word. Yeah.
Okay.
Is there something available online, or do they do training online, or you have to send someone to get them trained?
Training, that's usually done in person, and for the American Dental Association, with those individuals, as I mentioned, it's held at the ADA headquarters in Chicago, and it's a 2-day event, and they have specialists in communications lead those sessions, and they video record us and play it back, and we go over how we should do it better and all of that. So I just wanted people to be aware that those kinds of things exist, not only within the ADA, but also state dental associations often have some spokesperson training, and anybody interested in spokesperson training can contact the ADA. There's a question on chat line saying, how can I have a copy of fluoridation facts, and what's Dave's email? I think when Dave has those, Dave Waller in Sacramento has those copies of ADA fluoridation facts for the local health jurisdictions. He will contact you, and you can also contact me at howard.pollock@ucsf.edu. If you want an individual copy of fluoridation facts from the ADA, you can just Google that, and it's available at cost. There's a membership cost and a non-membership cost, and I think that for the oral health program, in California, multiple copies have been purchased for the local health jurisdiction. So that will be forthcoming, and hopefully that answers that question.
Hi, I have a question, Dr.
Yes,
Pollack. This is Sepida.
Go ahead.
I wanted to thank you, the presenters. It was very informative presentation. I just have a question for you. You focused on, based on the presentation, focused on external review and different phases. I just wanted to know, because I tried to go over the slides again to see if I missed it, but I wanted to know if there was any internal panel, like expert panel, that you developed the content of the toolkit based on the comments or suggestions of the panel?
I'm not specifically a panel. Vinodh can speak more to this, but we relied on the 3 phases of external review. As I mentioned, the first was with advocacy organizations. The second was with stakeholders at the National Oral Health Conference, and then we connected with a third phase with people who are based at academic institutions for their input as well. That is really, those were the sounding boards of expertise that we wanted to help, reinforce or identify issues that we needed to address.
Yes, that was a process. We mainly wanted to understand what the experts in this field think about it. So we came up with the first draft with the best that we could, based on the available literature and the experience that I have and CDHP has and Matt has. And after that, we had those 3 levels or 3 different rounds of review from different experts in the field. And so, yeah, that was our process.
Thank you so much.
I also wanted to mention that Matt is fully aware that a campaign for dental health, the ILikeMyTeeth.org website, has its own toolkit for water fluoridation. And there are a number of other toolkits for water fluoridation specifically. DentaQuest has one, and others. And so I just wanted to mention that. I think at this point I'm going to suggest that we end the presentation. There are further presentations on this series coming up, but not for a couple of weeks. The next one will be November the 27th, when Leon Asael, who's on our faculty here at UCSF, is actually going to be speaking about dental therapy in Minnesota, lessons for the future. So that should be an interesting topic. And then the following week, on December the 4th, Bianca Rogers from Oral Health America is going to share with us what that organization is all about and what they're doing currently. So with that, I want to thank our speakers, Matt Jacobs and Vinodh Bhoopathi. Thank you very much for taking the time out to prepare for this presentation and also to give it. It was very, very informative. Thank you.
Thank you. Thank you so much for having us, and thanks for all the people listening to it. And it's good to do this. Thank you so much.
Okay.
Yes, thank you.